going well. Kids are back to school and virtually doing whatever they need to do. So we continue to get a lot of great questions, and one came in this week, which is really poignant, I think. And I spend a lot of time talking to patients about that, because patients will come in and we'll say, well, what are you interested in? And when we're done with the laundry list of about 10 things from top to bottom, they're all important things to touch on, but it's not realistic to do them all at one time. And as any patient of mine will tell you, I kind of talk about two of my basic safety level kind of concerns, and one is how long do we operate, and when it comes to liposuction, how much do we take off? I kind of set body contouring for about a 6-hour limit, and lipo is about 5 liters. When it comes to head and neck, because it's a much smaller area, less physiologic demand, less risk for bleeding, things of that nature, some of the full face lifts, brows, blephs, some of those can run 8 hours. But when it comes to the body contouring, which is a big part of what I do, I have those 6-hour limits. So for folks who have more than 6 hours of work, I tell them we need to break this up into 2 parts. Or I've had patients who are really still very thick in their abdomen, wanting a tummy tuck. We'll go and we'll pre-lipo to shrink it down, go from here to here, so we can maximize their outcome after a tummy tuck. And so the general rule of thumb when it comes to staging operations, another good example is coming to mind is someone who's lost a lot of weight and they've got loose hanging skin in the front and the sides and the breasts and the arms and the neck. Those are all multi-stage people. But a general rule of thumb is the bigger the operation, the longer you kind of wait in between. So the minimum time for some things is going to be about 6 weeks. So for example, if I use that prepping the belly for a tummy tuck type of thing, I tell people 6 weeks would be the least amount of time, but in some people it really needs to be more like 12, because if the tissues are still very thick and swollen and they're not going to mobilize well, we're not going to get the most out of our tummy tuck. Whereas if I have folks that say, okay, I want to do like my body work, so let's say a lipoabdominoplasty, then I want to come back and have my breast done, that might be, that might be 4 to 6 weeks, because they're different operative sites. One's not dependent on the other per se from a swelling perspective. It's really more, how did the patient do? Did we have a lot of blood loss during surgery, which is not usually a problem? Did they respond? Did it zap their energy a lot? Do we need to wait for their battery to recharge? So I guess across the board, I can't tell you there's one hard and fast rule. It really comes down to the patient, how healthy they are, comorbid disease, what's the first operation compared to the second, did they have, bleeding and oozing and things like that kind of weakened and tired them after surgery that they got to kind of build back their strength for, and are these overlapping anatomic territories? I think those are all factors that have to come into play. So there's not a cookbook. Every patient is their own patient, and I spend a lot of time talking to folks about how we might put this puzzle together of the things they want to do. So, sorry, work's never done. So hopefully that answers the question. And like I said, I can lay it out, having done this for a long time. The ones that seem to work together, I kind of think of it like a Tetris puzzle, how the pieces fit together best to shorten the time from surgery to surgery, but yet maximize safety and outcome, which are always the 2 main concerns. So I'd love to talk to you about it. If you have questions, call the office, talk to Teresa or Tessa, they'll get you an appointment. Have a great weekend. Talk to you next week.